we just saw, there has been a relatively quick change in our genetic blueprint within a few thousand years. Joining us for more on this subject is Dr. Christine Sears. She's a biologist from Charité, and she says that even quicker changes within the genomic makeup are actually possible. How is that?
Well, this depends on the mechanism. Of course, there are also quick changes in terms of genetics. This is mutations, alterations in the sequence. This can happen during diseases, for example. But the major mechanism that can happen rapidly is called epigenetic mechanism. This does not influence the sequence of our genomic material, but these are chemical modifications of the material which are placed on top of it.
That means we kind of keep our genetic code, but we turn on or turn off certain genes.
Exactly. This is what usually happens. It influences the activity of a gene. We call it also fine-tuning. And it very often switches off genes. This is what we know best. But in the meantime, we also know that it can also switch on genes.
And which genes are we actually talking about?
Well, this depends on the situation we are talking about. For example, in a tumor situation, you need to switch off genes which normally stop cell growth. When we are grown up, cells don't need to grow. And so these genes are actively switched off via epigenetic mechanisms. And when these epigenetic mechanisms or alterations are removed, then the genes are turned on and the cell starts to divide while it shouldn't.
Okay. Nobody wants to get cancer, wants to get a tumor, so how can we actually influence this epigenetic mutation?
This is the question we also would like to answer as scientists. However, what we know is, of course, there are certain external things that can influence our epigenetic modifications. For example, smoking makes epigenetic modifications. Green tea is assumed to do some epigenetic modifications. Also, heavy metals are known as poisons, and we know that they influence epigenetic modifications of our material.
So nutrition, for example, has an influence. Is there also a chance to maybe reset this genetic pattern again?
In principle, there is one. And we know, for example, that during development, in the uterus, the fetus gets a reset of the epigenetic modifications, and at the same time certain modifications are set there, which are then given to the child. For example, the girls, of course, they have the egg cells, and here the epigenetic modifications are placed during development, and then they go on when the child is born.
That means also the behavior of a mother has a certain influence on the development of a child, of course.
This is very hard to put it scientifically in more detail. What we know, for example, is that after the Second World War, there was a shortage in nutrition. So the mothers were hungry. And 1 or 2 generations later then, in their children, or even after the next generation, we saw an early onset, for example, of certain diseases such as diabetes. And this is now traced back towards this phase where there was a shortage of nutrition.
So we actually learn from that, eat less, and your grandchildren will be more healthy.
It could be like that. It could be like that. We know already that eat less means live longer, and we also assume that now this has to do with epigenetic modifications.
Thanks a lot for the talk, Dr. Christine Sears.